Hi, I'm Tyler. I am certified in the McKenzie-based treatment of low back pain. I'm here today to do some exercise for general non-specific pain of the low back. I find that as we've been a little bit more inactive, haven't been to work, been at home for this past month and a half or so in quarantine, we may be experiencing more back pain, back stiffness. So I'm here to give you some what I find are the best or key exercises to maintain back health, or if you're having back pain, to consider trying some of these with the understanding that, you know, they might not be the perfect regimen for you, but hopefully they do give you some degree of help. So the first one we're going to start with is on your stomach going up on your elbows. So you can do this on the floor, you could do this on your bed. Um, for me, I'm going to do it on the floor. So you get down, and what I like to do, you can start flat if it's kind of stiff, okay? If you are feeling like it's no different than your normal position, what I recommend is you come up onto your elbows and try to relax the lower part of your body, okay? It's really important to not tense up in this position. If you squeeze in this position, nothing moves. The average person will bend forward, flex their spine about 6 hours in a day versus less than a half an hour of extension. So life is a matter of balance. It's important that you get a good amount of extension in the day as well. So we're doing prone on elbows here. Just want you to try to relax with me as we prepare our back to go in further into extension. What you may find is that there's an initial pinch in this position, but as you go, the hope is that it gets a little bit easier and less discomforting. Okay? So we'll spend one more minute here. Try to relax, try not to tense up, it's so easy. One of the tips I find is with your feet, try to get your toes to flatten on the ground. If you have them digging into the floor, you're going to squeeze more. If you're on your bed, you can hang your feet off the edge of the bed, and that definitely can help you relax a little bit better. Okay, so now that we've got our preliminary extension in, we've prepared our back for end range extension, we are going to do a press up. Okay, that is where we get our hands under our shoulders, and we are going to raise up, and we're going to attempt to relax our hips. Okay, let the low back sag. Okay, up again with me. Try to keep your elbows locked the whole time. Keep them straight and let your stomach sag. You want to try to keep your hips on the floor. If it's really stiff, you can let them come up a little bit. Okay, if you're really stiff, but try to get it to relax and sink down a little bit. Okay. So this is our fourth one. We're going to do about 10. If you find that any time during this video that the intensity of the pain gets more, or you start getting symptoms down your leg, you should stop. This exercise isn't necessarily for everyone, but it certainly can help a lot of people. Okay, last one. When I come down, I generally try to use my arms and not tense up my back, because that usually causes more discomfort. Okay, so now we have finished extension. So when I get up, I try not to flex my low back. You did all that nice work to try to extend your back, and now you want to try to maintain that inward curve. Okay, your spine has a curve to it. It's almost like an S shape, and the very low part of it caves in. And when you let it cave out, such as with slouching, what happens is you put more pressure on material to move out, potentially causing you pain. So we're going to practice sitting up correctly with that inward curve. So I recommend that you grab a chair. I've got a chair next to me over here. And what I'm going to do is try to train my brain to sit up with correct posture. This is a good exercise in training your postural muscles, but also how you sit during the day in order to correct slouch positioning. So what I'm going to start with is a slightly slouched position, not crazy slouch because I don't want to lose my inward curve too much, but slouched to inward curve. You can see how my back and the small of it comes in. And this is actually good position. This is normal position. Shoulders come back, ears are over shoulders, so your head comes back. If you guys have been having some neck pain, it's important that you have your head in the proper position, proper alignment, instead of maybe you're sitting, maybe you're on your phone or you're at your computer and you're letting your head come forward. So we're gonna hold this 10 seconds and then we're gonna come off. And we're gonna come right back up. So we don't spend a lot of time in the slouch position because we don't want our brain to think that that is okay. So we're gonna hold for 10 seconds, okay? And we're gonna let go just a little, just enough to let our brain know that it's slouched, but not enough to cause us problems with our back. Okay, this is number 3. We're gonna do 5 today. But what I like to do with this exercise, slouch and come right back up. I love to do this during the day, especially when I'm in the car. Car is when we spend a lot of time, typically in sitting. So it's very, very helpful to sit and correct yourself. Now, if you're getting more pain with this, only go to the point where it feels tolerable, okay? You don't have to super extend your back. And we're not trying to, we'll do one more here. We're not trying to go back as far as we can. We're trying to go just off of that, but keeping that inward curve at the same time. Okay, so there was our 5 of our, what I call our slouch corrections. Okay, and now we are gonna get into what is called a Miguel curl up. So the first part of it was based on the McKenzie method, and that was developed by Robin McKenzie. And the Miguel curl up has been around guy by guy of Stuart McGill, and it's more of an abdominal activating exercise, core exercise, but it also helps to reduce back pain. So find a space on your floor, okay? And what you're gonna do is one leg goes up and one stays down, and you're gonna put your hands underneath your back to promote that inward curve. Now, there are some people that say you should curl all the way up, and others where I tend to think that you should only come up just slightly. We don't really want to do a crunch because we don't want to flex our back, okay? Too many of us have pain because we flex our back. So I want you to just gently lift your head up, lift your shoulder blades slightly off of the floor, but at the same time, keep your stomach tense. Keep that inward curve. Hands are trying to push into your low back, okay? We're gonna keep going here for about 2 minutes. I want you to go at a steady pace, all right? Really tense that low back the entire time. Don't let it off. All right, we're gonna do 2 more and we're gonna switch our legs. Okay, and switch. Okay. Some of this rotation of the pelvis can help dissociate the sacrum, which is S1, and our L5, which is the very base of our lumbar vertebrae. Okay. Again, if this is causing you more pain, back off the intensity, back off the amount of repetition, or don't do it altogether. But if you're feeling okay, try to stick in there, hang in there. We're almost there. We're gonna do 4 more. 1, 2, 3, and 4. Okay. When you roll over, we are going to end with what I call a bird dog. So this is a good core activation exercise. Okay, you're going to get on your knees and your hands, and you're going to alternate extending your arm and your opposite leg. Okay, the goal of this is to not rotate your hips side to side. Okay, you want as much stability through your hips as possible and maintaining your stomach the whole time. Do not let your stomach arch or arch like a cat. Okay, so it looks like this. Extend and slowly bring it back down. Okay, and slowly bring it back down. Okay, we're not looking for quick movements. We're looking for control. And you should feel this not only in your hips and your core, okay, but you might even feel it in your entire leg. Really good is this exercise for pelvic stabilization, hip stabilization, okay? Almost there, keep going. Let's do 5 more each way. Three more. Should get tiring, that's okay. Don't let that make your form worse, okay? If your form starts to get worse, you should stop when it does. Rest, that's okay. And come on back up when you're ready. Okay. And try to maintain that inward curve after you finish with your exercises. And for the most part, you know, if you've been having some back pain trouble, try to incorporate some of these exercises if you find that they're helpful. But if they don't seem to work for you or you're having increased pain with them, what I would do is, you know, you could feel free to contact us for sure. And we could try to make a plan that's right for you. So hope you guys are doing well. We'll see you for the next video.